Huh. Thank you so much for this recognition and the honor of this award. I am particularly grateful to have received it from the New York Academy of Medicine, which I admire so much. I first learned about the Academy when I read a report from over a century ago that the Academy put out. It was in 1933, and you investigated 2,000 maternal deaths in childbirth in New York City. And what you published and described was how more than 2/3 would have been preventable with better practices. You outlined extremely concerning obstetric practices that included mismanagement of hemorrhage. It outlined the violations of basic antiseptic standards, horrendous injuries and infections from misuse of forceps. Publishing this work was an act of incredible courage. It changed the country. It led to a nationwide report and then improvements in standards that have had a dramatic effect on survival in childbirth in our country and ultimately around the world. Now, I was asked to say a few words about what gives me pause and what gives me hope. What gives me pause is that failures are no less concerning today than they were a century ago. They're different and they're more complex. But what gives me hope is that we are still a profession that calls out our failures, studies them, describes them, and then creates and deploys innovations in practices and technologies to improve them at massive scale, reaching the entirety of humanity. That is why I'm so proud today to have been honored and so grateful to you as an academy. Thank you.